So like I was saying, with the big shakeup that seems to be going on every day, a lot of regulations concerning like HIPAA and telehealth and such, they've been loosened in recent weeks. What can physicians expect going forward? Are these regulations going to return?
Yeah, we've had a tremendous number of waivers, and HIPAA is one of them. Also, just I would highlight telehealth with you as well because they kind of go hand in hand here. Prior to the crisis, Medicare didn't even cover telehealth outside of rural areas. Now there's been a huge waiver put into place. You can do telehealth. There's, as you mentioned, the HIPAA rules on privacy and security have been largely relaxed to allow for telehealth. And what we're seeing, just as we are, on a Zoom call today, we our medical practices are using Zoom. They're using other means. They have actual formal systems integrated into their electronic health records to do telehealth, which may be more HIPAA compliant. But there are a lot of folks out there, as we all well know, that need to use FaceTime or Skype or Zoom or some other means in order to communicate with their physician. And so at the moment, there are substantial waivers in place, including with HIPAA and telehealth, that allow for this. I think, unfortunately, I do see that some of those will come back into play after the crisis. There are obviously a lot of important protections that we all demand as patients in terms of our privacy. And not every one of those platforms is secure. And we're just trying to get care to patients in this emergency. So I do see a bit of a pendulum swinging back after this. I think certainly HIPAA, we do expect a lot of the relaxation to go away after this. It will be interesting because of that association with telehealth. It's going to be really interesting to see, if some of the laws will be changed permanently to allow for telehealth and potentially the unique issues with regard to security and privacy that come with telehealth. That remains to be seen if the public are going to demand telehealth or they're going to go back to seeing their doctor or, other providers in face-to-face visits in the future. So I think, what we'll see is that the type of care that is going to be requested by patients and demanded by patients, and the amount of, just like in our lives, of the balance of perhaps a little less security with more options. If we all potentially give up a little security on our iPhones every day, and so finding that balance is going to be tricky. But I do see those waivers not necessarily being relaxed permanently, but being kind of reeled in by the government at some point down the road.